Hello, my name is Jonathan, and I'm going to be discussing solution-focused brief therapy. Now, also my group is Heather and Lisa. So, to get started, solution-focused brief therapy was originated from clinical work by Milton Erickson and Gregory Bateson while doing research on communication. However, the main principles of solution-focused brief therapy was developed by Steve DeShazar and Insoo Kim Berg, who wrote this book and this book on solution-focused brief therapy. Later on, both Shazar and Berg founded the Solution-Focused Brief Therapy Association, whose organization can be found in SFBTA.org. Our main source of information for discussing solution-focused brief therapy comes from an interview transcript from Insoo Kim Berg, along with an article discussing solution-focused brief therapy in school settings for providing therapy for children with learning disabilities, and with the actual treatment manual that was developed by the SFBTA for 2010. Now, solution-focused brief therapy is a competency-based model which focuses on the client's strengths rather than focusing on the problems or the deficits of the client's situation. According to the article on the therapy, the originators of the therapy, Shazar and Berg, found that clients' concerns were resolved more effectively when therapists focused on the solution. Thus, the counselor takes a competency orientation rather than the deficit model orientation. The counselor does not engage in problem discussions. During the intervention, we will try to walk around it and rather focus on the good parts or the solutions that happen during that situation. Now, what makes the SFBT intervention so effective is its time constraints or time efficiency. In discussing my social work practicum, I work at Sacred Heart Children's Hospital. Now, I try to use the basic components of solution-focused brief therapy, but rather than having 6 sessions as mentioned in the manual, that is the standard for most solution-focused brief therapy, I only have 45 minutes. Whereas Heather may have 6 sessions over 6 months, and Lisa will have 2 sessions every 1 month. So it works in different time constraints. It works with different situations. It can be used in a school setting to work with children with learning disabilities. It can be used in a hospital to work with children dealing with cystic fibrosis and having to understand their illness, or everyday marriage counseling type situations. It can be used there as well. Now, according to the SFBTA, the main ingredients of the intervention consist of 1. Developing a cooperative therapeutic alliance with the client. So, as social workers, when we are dealing with clients in the brief therapy, we're their equals. They're the expert on their situation, so we have no place to make assumptions on why they're in that situation and make any judgments. Again, creating a solution versus focusing on the problem. The setting of measurable, changeable goals. Now, when they say that, for example, let's take a look with someone who has an alcohol issue. Rather than focusing on them cutting cold turkey, we can try to make measurable goals of saying that rather than having them drink 10 beers in 1 week, by the next week, have them try to decrease to maybe 6 or 5 beers, and then keep weaning them down until that's a measurable goal that they can keep track of. Number 4, focusing on the future through future-oriented questions and discussions. And along with that, we can end up putting the miracle question, which Heather will talk about a little later. Number 5, scaling the ongoing attainment of the goals to get the client's evaluation on the progress made. Again, scaling questions, which will be further discussed when we do the vignette of a therapy session. And focusing the conversation on exceptions to the client's problem and encouraging them to do more to make the exceptions happen. Now, for number 6, again, with brief therapy, we ask them, most people have had problems before, and they've solved them somehow. So we ask them how they solve them. When they feel like they haven't been able to have a solution before, we ask them, well, what made it different? What was the exception to the issue that made your problem go away? And that's just one example. So That's my
My name's Lisa, and I am going to be talking about how it compares and contrasts the different therapies out there. It will, like John said, it allows them to set their own goals and proceed how they want to. Solution-focused brief therapy focuses on the solutions rather than the problems. It also is designed to focus on the small successes and help clients achieve successes on their own. Solution-focused brief therapy can help, for example, social workers. I work in Idaho CPS, so our caseworkers have a very large caseload, so it can help the clients who have a variety of different problems, and it's all one therapy that can aid in the success of those problems. It's a strength-based therapy, and that helps when we talk about what kind of therapies we learn. The therapist can also implement the longer intervention techniques and aid in helping their progress. It can also be used towards different therapies and helping with those therapies as well. One of the criticisms of solution-focused brief therapy is it's too brief. The intervention is not long enough to really get to the main point that the client is trying to fix. It just helps a lot of the littler points. That's one of the criticisms. Like John said, some of the agencies and settings that it's been used in the past are school settings, caseworker settings, and different agencies. That's because it can be adapted and changed to fit the specific setting and implemented towards different things.
I'm Heather, and I found two goals that solution-focused brief therapy has, and that is to help assist the client in developing a vision for a more satisfying future, and to also help assist both the client and the practitioner in working together to make these visions of a healthier and more satisfying future a reality for them. So like John was saying, there's 6 sessions as a typical solution-focused brief therapy. And throughout those sessions, there's different things. Like the first session or beginning, you want to find out about the client. So who are they? What do they identify as the problem behavior? So when doing that, you don't want to give them answers or tell them why they're there, but you want to work with them and find out what they find is the identified issue for them. In that, you'll ask relationship questions. That's finding questions that work with having them look from a different person's perspective. So if they're married or have children, asking questions that help them look at what other people might see in those behaviors they've identified as the problem. Working on exception questions, like John had mentioned, looking at when this was just a little bit better, what things that happened or occurred around that time that caused things to be a little bit better. And that leads to coping questions, which are finding those identified coping skills that were helpful to make things just a little bit better, and how can you help implement that into their life. Working on scaling questions, scales of 1 to 10, being able to identify where they're at and what that looks like for them, and what can we do to help them identify ways to move up that scale. So what are those coping skills, or what are the things that help them be more effective? Working on the miracle question, like John said, that's a longer type question, so typically takes a little bit longer in working through, if a miracle happened last night and you woke up, what things would you notice? So working through the day with them, that could take a whole session, that could take more than one session, to work through what things are different, what things changed for them, and what things would they notice, using relationship questions also, and what things would other people notice through that process. Helping them to set goals for change, so what things can they do between now and the next session to help these things become a reality. And then you want to take a break and review these sessions and what happened, and come back and debrief before having them go away for the day.